Welcome to the WCC, Wound Care Certified Practice Prep, your comprehensive roadmap to mastering the science, and art of wound management. This course is meticulously designed for healthcare professionals who are ready to elevate their careers and achieve specialized certification in an ever-evolving clinical landscape. We have distilled the most complex wound care concepts, the latest 2026 clinical standards, and critical exam-taking strategies into 6 high-impact sections. Whether you are here to refresh your knowledge or are preparing to sit for the exam for the first time, my goal is to transform your study time into clinical confidence. Together, we will bridge the gap between textbook theory and real-world excellence, ensuring you are fully prepared to pass your exam and provide the highest standard of evidence-based care to your patients. Let's begin your journey toward becoming a certified wound care expert. Section 1. Wound Care Fundamentals, Assessment, and Basic Treatments. This section covers the foundational principles of wound management essential for the WCC exam. It tests your knowledge on the phases of wound healing, skin anatomy, tissue identification, such as Slough and Esker, and standard wound assessment techniques. It also introduces common wound etiologies, including pressure injuries, diabetic foot ulcers, and venous ulcers, along with fundamental treatment protocols, dressing selections, and holistic patient care strategies. 1. What is the very first stage of the human wound healing process called? The very first stage of wound healing is called the hemostasis phase today. This is when your blood clots quickly, stopping you from bleeding out fast. 2. Which layer of the skin contains the blood vessels and the tiny nerves? The dermis is the deep skin layer containing blood vessels and tiny nerves. It sits right below the epidermis, providing food and feeling to your skin. 3. What do we call the yellow, dead tissue inside a messy wound bed? We call the yellow, soft, and dead tissue in a wound bed slough. This dead tissue must be cleaned out, so the healthy red parts grow. 4. How often should you turn a patient in bed to stop pressure sores? You must turn a patient in bed every 2 hours, day and night. Moving him relieves the heavy pressure, allowing blood to flow to the skin. 5. What kind of bandage should you use on a wound that is dry? You should use a hydrogel bandage on a wound that is very dry. Hydrogel adds the needed moisture back, creating a warm and wet healing space. 6. What is the thick, black, dry tissue in a severe wound called now? The thick, black, and very dry dead tissue is called esker by doctors. This hard crust acts like a bad scab, preventing the wound from closing. 7. Which phase of healing builds new tissue and grows new blood vessels quickly? The proliferation phase is when the body builds new tissue and blood vessels. This stage fills the empty hole with healthy red cells, closing it up. 8. What type of wound occurs on the bottom of a diabetic patient's foot? A diabetic foot ulcer usually happens on the bottom of their numb feet. High sugar ruins their nerves, so they cannot feel damage happening down there. 9. Why do we measure wounds like a clock face during our daily checks? Measuring like a clock helps every nurse record the exact size and shape. The patient's head is 12, making it easy to track changes every day. 10. What fluid is the safest choice for washing out a normal, dirty wound? Normal saline is always the safest fluid for washing out a dirty wound. It is gentle salt water, which cleans the hole without hurting good cells. 11. What does green, smelly fluid coming from a wound usually tell the nurse? Green and smelly fluid usually means the wound has a very bad infection. You should tell the doctor quickly, because the patient probably needs strong antibiotics. 12. Which grade of pressure sore shows bare bone or muscle at the bottom? A stage 4 pressure sore is deep enough to show bare bone today. This is the most serious level, taking a very long time to fix. 13. Why do we put tight compression wraps on legs with swollen venous ulcers? Tight wraps help push the pooled blood and fluid back up the leg. This takes the swelling away, allowing the broken leg skin to finally heal. 14. What machine uses a sponge and suction to close up a large hole? A wound vac machine uses suction and a black sponge to close holes. It pulls out the extra wetness, drawing the skin edges close together fast. 15. When should you give a patient their pain medicine during a bandage change? Give the pain medicine about 30 minutes before you start changing the bandage. This gives the pill enough time to work, keeping the patient comfortable today. 16. What important nutrient must a patient eat plenty of to build new skin? A patient must eat plenty of good protein to build healthy new skin. Protein acts like strong building blocks, making the repaired tissue tough and thick. 17. What does a stage 1 pressure injury look like on a patient's heel? A stage 1 pressure injury looks like a red spot that stays red. The skin is not broken yet, but the redness warns you of danger. 18. Which healing phase can last for 2 years while the scar gets strong? The maturation phase can last up to 2 whole years to finish completely. During this long time, the scar tissue gets flatter, lighter, and much stronger. 19. What metal do we sometimes put in bandages to kill germs and bacteria? We often use silver inside our special bandages to kill bad germs quickly. Silver naturally destroys the bacteria, keeping the open wound safe from new infections. Section 2. Please remember to get the full course from the link in the description. This section focuses heavily on lower extremity wounds, specifically differentiating between arterial and venous ulcers. It covers their clinical presentation, underlying causes, and appropriate interventions, such as when to use or avoid compression therapy. Additionally, this section tests your knowledge on vital diagnostic tests like the ankle brachial index, ABI, identifying clinical signs of wound infection, proper wound swab culture techniques, and the safe application of specialized topical treatments like medical honey. 20. What type of leg wound looks like a perfectly round punched hole? An arterial ulcer looks exactly like a perfectly round, punched-out hole. These round wounds happen because the skin dies quickly from lack of oxygen. 21. Where do you most commonly find painful arterial ulcers on a patient? You will most commonly find arterial ulcers on the tips of toes. The toes are far away from the heart, so they lose blood first. 22. How does a patient's foot feel when they have severe arterial disease? The patient's foot will feel very cold when you touch it softly. Without warm blood flowing down the leg, the skin turns completely ice cold. 23. What causes the dark brown stains around a messy venous leg ulcer? The brown stains come from old blood cells breaking down right there. The leaky veins let blood out, leaving dark colors on the lower leg. 24. Does elevating the legs help a patient with a venous leg ulcer? Yes, elevating the legs helps venous ulcers feel much better very quickly. Raising the legs helps gravity pull the stuck fluid back up the body. 25. Why should you never put tight compression wraps on an arterial wound? Tight compression wraps will squeeze an arterial wound and stop blood flow. Stopping the blood completely will cause the foot to turn totally dead fast. 26. What does the special Abbey test measure on a wound care patient? The Abbey test measures the blood flow traveling down into the leg. It compares arm pressure to ankle pressure, checking for dangerous arterial blockages. 27. What should you do if the Abbey score is dangerously low today? If the Abbey is low, do not use tight compression wraps ever. A low score proves the blood flow is too weak for heavy squeezing. 28. What is a clear sign that a wound has a bad infection? A clear sign of a bad infection is a sudden terrible smell. Bad germs growing inside the wound bed make a very nasty, strong odor. 29. What test tells the doctor exactly which bad bug caused the infection? A swab culture tells the doctor exactly which bad bug caused trouble. Knowing the exact bug helps them choose the perfect, strongest antibiotic pill. 30. What must you do before taking a swab culture from a wound? You must clean the wound with normal saline before taking the swab. Washing away old drainage ensures you only test the true, deep wound germs. 31. Where should you firmly rub the testing swab inside the messy wound? You only want to swab the healthy, red, clean tissue inside there. Never rub the swab on dead slough or hard, dry, black eschar tissue. 32. Why do some doctors use special medical honey on a large wound? Medical honey pulls water out of bad germs, which kills them fast. This safe, natural trick helps clean the wound and makes it heal nicely. 33. What allergy must you check for before putting medical honey on wounds? Always check if your patient is completely allergic to flying bees first. People who are allergic to bees might have a dangerous reaction to honey. 34. How do the edges of a venous ulcer look compared to arterial? Venous ulcers usually have very uneven, messy edges all around the wound. Arterial wounds are perfectly round, but venous wounds spread out very randomly everywhere. 35. What happens when you hang an arterial patient's leg off the bed? Hanging the foot down off the bed helps ease their pain slightly. Gravity helps pull a little bit of fresh blood down into the toes. 36. What kind of fluid usually comes out of a normal venous ulcer? Venous ulcers leak a lot of clear fluid, making the skin wet. The high pressure in the damaged leg veins forces water through the skin. 37. Can a high fever mean the patient's small cut is completely infected? Yes, a high fever often means the wound infection is spreading badly. A fever is the body's natural response to fighting dangerous, strong foreign germs. 38. What type of cream safely cleans a wound without hurting good cells? Creams that have iodine can clean the area safely without hurting cells. Iodine destroys the harmful bacteria, but leaves the fresh-growing skin perfectly alone. Section 3. Debridement methods, burn management, and advanced assessment. This section dives into advanced wound care techniques, focusing on the various methods of debridement, autolytic, chemical, mechanical, and sharp surgical. It also extensively covers burn management, including burn depth classification, superficial, partial, and full thickness, fluid resuscitation, and specialized patient needs like temperature control. Finally, it reinforces essential clinical skills such as assessing wound tunneling using the clock face method, the critical role of nutrition, calories, zinc, vitamin C, in severe healing, and the legal importance of thorough nursing documentation. 39. What do we call the process of removing dead tissue from a wound? The process of removing dead tissue from a wound is called debridement today. Cleaning out the bad tissue allows the healthy red skin to grow back. 40. Which debridement method uses the body's natural moisture to melt yellow slough? Autolytic debridement uses the body's natural fluids to safely melt away dead tissue. It is a very gentle process, but it takes a very long time. 41. What must you avoid when you apply special chemical creams to a wound? You must avoid putting the chemical cream on the healthy, red skin edges. The strong chemicals can burn and damage the perfectly healthy skin right there. 42. Why do nurses try to avoid using wet to dry bandages on patients right now? Nurses avoid wet to dry bandages because ripping them out causes extreme pain and damage. This mechanical pulling tears away the good cells along with the bad slough. 43. What is the fastest method to remove thick, black eschar from a hole? Sharp surgical debridement is the absolute fastest way to remove thick, black eschar. A doctor uses sharp scissors to quickly cut out the bad, dead parts. 44. What kind of burn only hurts the top layer, like a bad sunburn? A superficial burn only damages the very top epidermis layer of the skin. The skin turns red and feels painful, but you will not see blisters. 45. Which type of burn causes big, painful blisters to pop up on skin? A partial thickness burn causes big, painful blisters to form on the skin. This burn reaches deep into the dermis, causing fluid to rush up fast. 46. Why should you never pop the blisters on a partial thickness burn wound? You should never pop blisters, because an open blister invites dangerous germs inside. The clear skin bubble acts like a natural, safe shield against bad bacteria. 47. What does a full thickness burn look like when you examine the patient? A full thickness burn looks white, gray, or black, feeling like tough leather. All the skin layers are completely destroyed, requiring special surgery to fix it. 48. Why might a patient not feel pain from a severe, full-thickness burn? The patient might not feel pain, because the burn destroyed all nerve endings. Without any working nerves, the brain cannot receive the painful signals going up. 49. What must you give a severe burn patient very fast through an IV? You must give the patient massive amounts of fluid fast through an IV. Burned skin leaks out water quickly, causing dangerous dehydration inside the patient's body. 50. Why do we keep the hospital room very warm for severe burn patients? We keep the room warm because burn patients lose body heat extremely fast. They lost their protective skin, making them shake and freeze without extra heat. 51. What happens to a burn patient's daily calorie needs while they are healing? A burn patient needs to eat thousands of extra calories every single day. The body works incredibly hard to rebuild destroyed tissue, requiring massive food energy. 52. Which specific mineral helps the body build new skin cells very fast today? Zinc is a specific mineral that helps build new skin cells very fast. Without enough healthy zinc in the blood, the wound will remain completely open. 53. Why is documenting your wound care work incredibly important during every nursing shift? Documenting is important, because the court says if it is unwritten, it never happened. Your accurate notes protect you legally, proving you did your job perfectly today. 54. What soft tool do you use to measure the hidden tunnels inside wounds? You use a soft, cotton swab to gently measure the hidden, deep tunnels. The soft cotton tip prevents you from accidentally hurting the sensitive, hidden tissue. 55. How do nurses describe the exact location of a tunnel to other nurses? Nurses use a clock face to describe exactly where the hidden tunnel lives. Pointing out the clock number helps the next nurse find the exact spot. 56. Where does a wound tunnel live if it points straight to the right? If the tunnel points straight to the right, it is at 3 o'clock. The patient's head is always 12, making the right side exactly 3 o'clock. 57. What vitamin do we give burn patients to help their skin repair properly? We always give burn patients extra vitamin C, helping their skin repair properly. Vitamin C builds strong collagen fibers, closing the large holes safely and completely. Section 4, Geriatric Skincare, Skin Tears, and Moisture Damage. This section addresses the unique challenges of geriatric wound care, specifically focusing on the prevention and management of skin tears and incontinence-associated dermatitis, IAD. It covers safe patient handling techniques, proper wound cleansing without causing further trauma, and appropriate dressing selection for highly fragile skin. Additionally, it highlights crucial systemic factors that impact wound healing, such as identifying severe dehydration, understanding the role of nutritional support, like vitamin A, and recognizing the critical need for glycemic control in diabetic patients. 58. What happens to the skin of older patients as they get very old naturally? The skin becomes very thin and fragile, tearing like delicate tissue paper very easily. Older patients lose their thick skin padding, making them prone to painful skin tears. 59. Why must you never grab an older patient by their arms during a transfer? Grabbing their arms tightly will easily peel their fragile top skin straight off today. The extreme pressure from your tight fingers causes massive tearing on their frail arms. 60. What is the best way to move an older patient without tearing their skin? You should use soft moving blankets to gently roll the older patient around safely. Soft blankets spread out the heavy pulling pressure, protecting their delicate skin completely today. 61. What is the very first thing you do when a fresh skin tear bleeds? You must immediately apply gentle pressure to stop the bright red bleeding right away. Stopping the active blood loss keeps the frail patient perfectly safe and somewhat calm. 62. What liquid should you use to clean a dirty, fresh skin tear wound safely? You should always use normal saline water to wash the torn area completely clean. Normal saline is extremely gentle, removing the bad dirt without hurting the broken cells. 63. What should you do with the loose skin flap on a fresh skin tear? You must carefully roll the loose skin flap back into its original, normal place. Leaving the skin flap flatly in place acts like a wonderful, completely natural bandage. 64. Why should you avoid putting sticky medical tape directly on a fragile skin tear? Sticky medical tape will severely rip the frail skin again when you remove it. Removing the sticky tape acts exactly like painful waxing on the patient's delicate arm. 65. What type of soft bandage should cover a delicate skin tear on an arm? You should use a non-stick pad, holding it down with a soft gauze wrap. The non-stick pad prevents painful tearing, keeping the broken skin safe during bandage changes. 66. What causes incontinence-associated dermatitis on a very sick patient in the hospital bed? It happens when harsh, wet urine stays trapped against the sensitive skin very long. The wet diaper holds the burning fluids tightly against the bottom, causing severe damage. 67. What does the broken skin look like when a patient has bad moisture damage? The damaged skin looks extremely red, feeling very painful to the poor sick patient. The harsh moisture literally burns the healthy skin layers away, leaving an open sore. 68. What kind of soap should you use to clean a wet, soiled diaper area? You must use very gentle soap, wiping the dirty bottom with extreme, careful softness. Harsh scrubbing soaps will break the red, fragile skin, making the AW full sore worse. 69. Why do nurses put heavy zinc oxide creams on a patient's red, sore bottom? Heavy zinc oxide creates a thick barrier, blocking the harsh urine from the skin. The strong cream acts like a solid shield, giving the red skin time to heal. 70. Why does dangerous dehydration make an older patient more likely to get skin tears? Extreme lack of water makes the skin terribly dry, causing it to tear easily. Plump and wet skin stretches safely, but extremely dry skin just cracks and breaks. 71. Where should you look to find clear warning signs of extreme body dehydration daily? You should carefully check the patient's mouth and lips for extreme, bloody, dry cracking. Cracked lips clearly show the entire body lacks the necessary water to survive well. 72. What healthy vitamin helps fight off bad germs and keeps soft skin very healthy? Vitamin A helps keep the soft skin healthy, fighting dangerous bacterial infections off wonderfully. This strong vitamin builds a massive defense army, protecting the fresh cut from invaders. 73. What orange vegetables are completely full of healthy vitamin A for your sick patients? You can find high amounts of vitamin A in orange carrots and sweet potatoes. Feeding patients these healthy orange foods helps their broken skin heal much faster today. 74. Why do we closely monitor the daily blood sugar levels of a diabetic patient? Extremely high blood sugar violently slows down the body's natural wound healing process completely. Thick and sugary blood blocks the tiny cells from closing the big, gaping hole. 75. What medication do diabetic patients take to fix their incredibly dangerous high blood sugar? Diabetic patients must take their proper insulin shots right at their daily feeding times. The powerful insulin quickly lowers the high sugar, allowing the broken wound to close. 76. What must you never do when cleaning the painful red skin of moisture damage? You must never scrub the painful red area, because scrubbing breaks the fragile top. Aggressive scrubbing forces the weak skin layers apart, creating a brand new bleeding wound. Section 5, Advanced Dressings and Ostomy Care Management. This section covers advanced wound dressings and fundamental ostomy care. It tests your knowledge on selecting appropriate dressings, such as transparent films, hydrocolloids, and calcium alginate, based on wound drainage levels and infection status. It also extensively reviews ostomy management, including assessing stoma health, color and viability, protecting the peristomal skin, proper pouch measurement and application techniques, and patient education regarding diet and waste tracking. 77. What type of clear bandage looks exactly like thin, clear plastic tape? A transparent film bandage looks exactly like thin, clear plastic tape today. It protects small, dry cuts while letting the nurse easily see inside. 78. Why should you never use a clear film on a very wet wound? You should never use it, because the extra fluid will pool dangerously underneath. The clear plastic traps the water, making the open wound much worse. 79. What type of soft bandage acts completely like a thick second skin? A hydrocolloid bandage acts exactly like a thick, safe second skin layer. It turns tiny amounts of wound moisture into a warm, soft gel. 80. What type of pressure sore is absolutely perfect for a hydrocolloid bandage? A stage 2 pressure sore is perfect for a warm hydrocolloid bandage. The bandage protects the popped blister, keeping it warm and slightly wet. 81. Why must you never put a hydrocolloid on a badly infected wound? You must never use it, because it traps all the dangerous germs inside. Trapping the bad bacteria makes the awful infection grow incredibly fast today. 82. What special bandage comes from natural seaweed and drinks massive fluid amounts? Calcium alginate is a special bandage made entirely from natural ocean seaweed. It absorbs heavy wound drainage, turning into a protective gel right away. 83. What type of wet wound is best for a calcium alginate bandage today? Deep tunnels that leak heavily are the best spots for calcium alginate. The dry seaweed rope fills the hole, soaking up the deep fluid. 84. What is the red piece of intestine sticking out the belly called? The bright red piece of intestine sticking out is called a stoma. Surgeons create this opening to safely let nasty body waste exit outside. 85. What color should a perfectly healthy stoma look like every single day? A healthy stoma should always look extremely bright red and very moist. The bright red color proves there is plenty of good blood flowing. 86. What does a dark purple stoma clearly tell the wound care nurse? A dark purple stoma clearly tells the nurse the blood flow stopped completely. You must call the doctor immediately, because the tissue is dying fast. 87. When should you completely empty a patient's plastic ostomy pouch of waste? You should empty the pouch when it is exactly 1/3 full. If the bag gets too heavy, the weight pulls the sticky plastic off. 88. What is the soft skin completely surrounding the stoma hole called today? The soft skin completely surrounding the stoma is called the peristomal skin. This sensitive area gets damaged extremely fast by leaking, burning stomach acid. 89. What do wound nurses use to seal the ostomy bag against the belly? Nurses use special, thick stoma paste to securely seal the bag tightly. The thick paste fills any weird skin gaps, stopping nasty waste leaks. 90. Why must you perfectly measure the stoma before cutting the new pouch? You must measure it perfectly, so the plastic hole fits exactly right. An exact fit prevents burning waste from touching the healthy belly skin. 91. What dangerous thing happens if you cut the pouch hole too small? If the hole is too small, it chokes the red stoma dangerously tight. Choking the stoma blocks the fresh blood, causing the red tissue to die. 92. What should you use to gently clean the stoma during a pouch change? You should use soft, warm water to gently wash the stoma nicely. Warm water is very gentle, cleaning the red tissue without causing pain. 93. Why should a nurse avoid using harsh body soaps on the peristomal skin? You should avoid harsh soaps, because they leave a sticky film behind. The sticky soap film stops the new plastic pouch from sticking tightly. 94. Why must an ostomy patient chew their solid food extremely well daily? They must chew food well to prevent painful blockages inside their bowels. Large chunks of food get stuck easily, causing severe medical emergencies fast. 95. Why do we constantly record the exact amount of pouch waste daily? We record the amount, helping doctors know the digestive system works perfectly. Tracking the output volume confirms the patient is nicely absorbing their food. Please remember to get the full course from the link in the description. Section 6, Pressure Injury Prevention, Legal, Ethical Guidelines, and Documentation. This final section covers essential pressure injury prevention protocols, including thirds of support surfaces, like air mattresses and heel protectors, and the ongoing necessity of a strict turning schedule. Crucially, it shifts focus to the legal and ethical responsibilities of a wound care nurse. It tests your understanding of patient rights, informed consent, the legal definition of battery, and strict, legally sound documentation standards, such as avoiding size estimations, banning whiteout, and properly correcting chart errors. It concludes with a reminder of the ultimate nursing goal and some final exam encouragement. 96. What kind of special mattress helps stop bad pressure sores on sick patients? We use special air mattresses, which pump soft air in and out all day. The moving air changes heavy pressure spots, letting the fresh blood flow perfectly well. 101. Do you still need to turn patients if they have a special airbed? Yes, you still must turn your sick patient every 2 hours continuously all day. The fancy bed helps nicely, but turning is the absolute only way to completely stop pressure. 102. Why must you never leave a sick patient laying on a wet bed sheet? You must never leave them, because heavy moisture quickly destroys the fragile skin layers. The wetness breaks the weak cells apart, creating a large, painful open hole very fast. 103. What soft tool do nurses use to protect a sick patient's fragile heels? Nurses use soft foam boots to completely protect the delicate heel from touching hard beds. The soft foam lifts the sharp bone, stopping it from pushing through the extremely thin skin. 104. Why is the delicate heel very easy to break open on an older sick patient? The heel breaks easily because the sharp internal bone pushes hard against the thin skin. There is very little fat padding there, making it an extremely dangerous heavy pressure spot. 105. What must you get from the patient before touching their painful open wound today? You must always get the patient's direct permission before you touch their open wound. This direct permission is called informed consent, proving they fully agreed to the safe cleaning plan. 106. What exactly does informed consent mean for your sick patient in the hospital? Informed consent means the patient completely understands the entire wound cleaning plan very clearly. They must totally know exactly what you are doing before you remove the dirty, old bandage. 107. What must you immediately do if a conscious patient says no to a bandage change? If a patient quickly says no, you must completely stop and tell the doctor immediately. You must totally respect their personal choice, even if you clearly think the planned treatment is good. 108. What is the severe legal crime called if you force treatment on a refusing patient? Forcing a medical treatment on a refusing patient is legally called a terrible, violent battery. You can permanently lose your precious nursing license if you touch them without their direct permission. 109. Why must you never guess the size of a wound in your official computer notes? You must completely never guess, because your daily typed notes are exact legal facts for the court. Always use your accurate measuring stick, recording the exact correct length, width, and deep depth every time. 110. How should a careful nurse correctly fix a silly written mistake on paper medical notes? You should draw one single straight line right directly through your completely wrong, silly word. This single line safely shows the reviewing lawyers that you made a tiny mistake without hiding anything secretly. 111. What must you quickly write next to the single line when fixing a written mistake? You must quickly write your personal initials next to the single line, showing you fixed the error. Your personal initials prove exactly who made the little correction on the paper chart that specific day. 112. Why is white correction fluid completely banned from all hospital paper medical charts right today? White correction fluid is totally banned, because angry lawyers will think you are hiding bad, awful secrets. The serious court needs to clearly see your original word to completely trust your given medical care facts. 113. What should you nicely do with your notes before walking into the final big exam? Take a huge deep breath, read your simple notes, and completely trust your smart brain today. You have honestly studied incredibly hard, and you are totally, completely ready to pass this final test. 114. What is the ultimate, main professional goal of every single wound care nurse working today? The absolute main goal is helping sick patients heal safely and feel completely comfortable every daily shift. Your gentle, loving care protects their open skin, giving them a much better, happier, and healthier life.